If you have been advised to make dietary changes, there are a number of things to consider. We need some cholesterol to stay healthy, though there are some forms which are considered bad for us. Fortunately, many people can lower their cholesterol by eating healthily, and making lifestyle changes. High cholesterol does not tend to cause symptoms, so you can only find out if you have it from a blood test. Certain foods may help reduce your cholesterol, as part of a healthy diet. One study found that eating 50 grams of quinoa daily for 6 weeks lowered total cholesterol, triglycerides and LDL cholesterol. It comes as a small-shaped seed-sized food and has a slightly nutty flavor and firm texture. When cooked, its grains quadruple in size. Eating other healthy foods may also lower your cholesterol. New COVID variant fears. There are 2 COVID symptoms in fully vaccinated to spot, the NHS says. To reduce your cholesterol, try to cut down on fatty food, especially food that contains a type of fat called saturated fat. You can still have foods that contain a healthier type of fat called unsaturated fat. The British Dietetic Association, BDA, says, compare labels and choose foods with green or amber labels for saturates. Foods are high, red, in saturated fat if they contain more than 5 grams of saturated fat per 100 grams. Foods containing 1.5 grams or less per 100 grams are low, green, in saturated fat. The longest you should go without showering during winter. Tip: longevity, the essential lifestyle tip to ward off chronic disease. In Alzheimer's disease, the vitamin deficiency found in 70% of patients. Insight. Nonetheless, the BDA notes, some healthy foods that are high in fat like oily fish, nuts and oils, may be red for saturated fat. This is okay, as they contain more of the healthy unsaturated fat. It has outlined a few small changes to your diet which it says can make a big difference to your cholesterol level. It says, to help lower your cholesterol you don't need to avoid fats altogether. You should cut down on foods high in saturated fat and replace them with food high in unsaturated. These foods high in unsaturated fat include things such as nuts, seeds, avocado and oily fish. Lastly, the organization advises eating plenty of fiber. This helps lower your risk of heart disease, and some high-fiber foods can help lower your cholesterol. To make sure you get enough fiber, it says you should aim for 5 portions of fruit and vegetables a day, switch to whole grain varieties of bread, cereals, pasta and rice, and choose other high-fiber foods such as pulses. The NHS outlines a number of other lifestyle changes you may be able to make to lower your cholesterol. A key one is to cut down on alcohol. You should try to avoid drinking more than 14 units of alcohol a week, and avoid binge drinking. You can ask your GP for help if you are struggling to cut down. You might need medicine to lower your cholesterol if your cholesterol level has not gone down after changing your diet and lifestyle. You may also need medicine if you're at a high risk of having a heart attack or stroke, according to the NHS. Statins are the most common medicine for high cholesterol, according to the Health Service. Statins work by reducing the amount of cholesterol your body makes. The NHS says, like all medicines, statins can cause side effects. But most people tolerate them well and do not have any problems.